Good afternoon, and welcome to the Council of State Governments Midwestern Legislative Conference webinar series, Promoting Growth and Shared Prosperity for a Better Midwest. I'm Laura Tamaka, and I'm the staff liaison for the Midwestern Legislative Conference Economic Development Committee, which is sponsoring this webinar series. Today's event is co-hosted by the MLC Health and Human Services Committee, and I'm joined today by John Davis, who is the staff liaison for that group. We are also joined by our colleagues, Jenny and Christina, who will help with the running of today's event. Before we get started, I wanted to review a couple of housekeeping notes. Today's webinar is being recorded, and a copy of that recording will be made available through the CSG Midwest website after the event. Please keep your audio muted during the presentations to help us reduce the background noise. Also, after each presentation, we'll open up for questions and comments, and then at the end of all the presentations, we'll engage in open discussion. So please continue to submit your questions in the chat and raise your hand, and our staff will call on you to speak during those periods. As I previously mentioned, this event is sponsored by the MLC Economic Development Committee and the MLC Health and Human Services Committee. I would like to thank our respective officers for both of those committees for their work, leadership, and guidance in planning for this session. Joining us today are Illinois Senator Linda Holmes, who is co-chair of the Economic Development Committee, and Minnesota Representative Jennifer Schultz and Michigan Representative Brana Colley, officers of the Health and Human Services Committee. At this point, I'm going to turn things over to Illinois Senator Linda Holmes, who will further introduce today's session. Senator?
Sorry about that. As always, I needed to unmute myself. Thank you, Laura, and thank you to my colleagues on both committees for hosting this event and to all of you who have joined us today. And a special thank you to our presenters for the time and effort they've put into preparing for today's session. Since October, the MLC Economic Development Committee has been hosting a 6-part webinar series promoting growth and shared prosperity for a better Midwest. During each installment of the series, the committee is partnering with another of the MLC's policy committees to present a virtual event on a topic of mutual interest. Our goal is to examine issues that play a role in the economic health and well-being of our region, and to discuss strategies that lead to greater prosperity for our communities and citizens. To date, we've already held events on the future of the ethanol industry with the MLC Agriculture Committee, youth apprenticeships, that was with the MLC Education Committee, and education and training for prisoners and ex-offenders, that was with the MLC Criminal Justice Committee. Today, we're partnering with the MLC Health and Human Services Committee, and I'd like to thank the officers and members of that committee for co-hosting this session. The early child care and education industry in this nation was under considerable strain during the pandemic. Tight financial margins for providers and low wages for workers, coupled with the high costs for parents, had put many centers in a precarious situation. The pandemic only compounded these challenges. And in the past 18 months, we've seen many centers and at-home care close their doors permanently. Many that remain open are operating with reduced enrollment. The struggle to find reliable, high-quality, affordable childcare has implications for the workforce and the economy, especially as some parents have to choose between working and staying home with young children. Today, we're going to take a look at these challenges and some potential solutions. We have some great presenters lined up for today's discussion. And at this point, I'm going to turn things over to Minnesota Rep. Jennifer Schultz, Chair of the MLC Health and Human Services Committee, who will further introduce this session.
Thank you, Senator Holmes, and welcome everyone to today's web event. To add to Senator Holmes' comments, we are experiencing significant challenges in the area of early child care and education. And these challenges have sent ripples through our labor markets and the economy, as well as impacting families and the futures of significant numbers of children. We hope that through today's discussion, we can gain a better understanding of the barriers and issues that face working families as they look for affordable childcare options, and hopefully we'll look at potential solutions as well. Now, to start off today's conversation, I'm pleased to introduce Diane Schilder and Heather Sandstrom, who are both senior fellows at the Urban Institute Center on Labor, Human Services, and Population. Ms. Schilder studies childcare and early education programs, elementary and secondary programs and policies, and higher education initiatives. She has worked with Harvard University, the U.S. Government Accountability Office, and recently directed evaluations of initiatives funded by the National Science Foundation and the U.S. Department of Education. Ms. Sandstrom's work focuses on early childhood development and public programs that support the well-being of low-income children and families, such as Head Start, Early Head Start, childcare subsidies, and maternal and child home visiting. Thank you both for joining us today, and I'll turn things over to you.
Thank you so much. So I'm going to begin today's presentation. And again, our focus is on addressing the childcare crisis to preserve jobs and grow the economy. So the next slide provides an overview of our remarks. We're going to start by talking a little bit about early care and education, understanding the major public funding streams, talk a little bit about the economic benefits of early care and education, talk a bit about the crisis and how the crisis has affected different sectors, as well as the consequences for children and families. And then talk a bit about some of the policy opportunities, especially in light of some of the federal stimulus funds and what states are doing to advance these funding opportunities. The next slide presents an overview of the three major public funding streams. We often think of these as separate programs, but Head Start, childcare, and pre-K can also be viewed as funding streams. Head Start is a direct federal to local grantee program that focuses primarily on comprehensive child development services through part-day programs. Childcare provides mostly full-day, full-year out-of-home care, either in home-based settings, family childcare settings, or childcare centers. And pre-K, we often think of as being offered in public schools, but across many states, again, pre-K funds can be used in centers and even family childcare homes to provide early enrichment services to young children. So each of these provide early care and education opportunities to young children, but the goals are slightly different, and therefore they tend to be administered slightly differently. The next slide shows the public funding levels and the number of children who are served. And it looks like that goes into each one of these programs. If you just look at that top line, Head Start has nearly $10 billion in federal funding, childcare over $10 billion, and pre-K, mostly it's state dollars, but about $9 billion. And yet, what we see here is that the United States is ranked 39th in the world in terms of public funding for childcare and early education. And in fact, even though combined, these programs serve over 3 million children, a sizable percentage of children are not served through public funds. And in fact, most of the childcare and early education expenses are fall on families. So families pick up most of the expenses, unlike public education. The next slide shows the range of programs that comprise the early care and education workforce. So you can see here again, there are home-based early care and education programs, nonprofit center-based programs, special education, Head Start, Early Head Start, and then school-based pre-K, as well as pre-K funds that can go to other centers. So you have a very fragmented system. Unlike public school, where you might have one school around the corner that your children might go to, in the case of early care and education, there are a range of different services. And again, for the most part, parents are responsible for the fees. The next slide shows that about 60% of children under age 5 experience some form of non-parental care. This includes not only formal childcare and pre-K, but family, friend, and neighbor care. You see that higher rates of preschool-age children use center-based care. And again, as I have mentioned, parents pay most of the cost. The next slide is very busy, but I just wanted to point out that to the left of the screen, you can see the percentage of infants and toddlers in different care settings. And on the right, you see the percentage of preschool-age children. So you see that slightly higher percentages of preschool-age children are attending some type of out-of-home care. But in the case of infants and toddlers, they tend to be mostly in relative care, whereas for preschool-age children, they're mostly in center-based programs. And you see that the percentages have remained relatively flat over the last several decades. The next slide shows the return on investment. So a lot of folks ask, why would the public be interested in supporting childcare and early education? Well, a lot of studies have shown that for every dollar spent on high quality early care and education, it's estimated to lead to at least $3 in cost savings. Some very high quality programs have been shown to lead to over $9 in cost savings. This is in terms of reduced retention in grades in elementary school, in terms of academic success, and in terms of children's social well-being. Similarly, recent research has been showing that the Social Security Administration projects that by next year, the annual Social Security revenues are going to fall short of costs. And if adequate numbers of Americans are not participating in the workforce, this shortfall is likely to increase. So fully funding childcare subsidies and childcare costs can incentivize parents to go back to the workforce or remain in the workforce. The next slide shows the benefits for families with young children. And parents are able to work if they can find and afford childcare with reasonable effort. A number of studies have actually shown parents are more likely to not only go back into the workforce, but also to regularly participate in the workforce. You're less likely to see absenteeism from employees. In addition, currently, childcare costs are one of the highest expenses that families incur. It often exceeds the cost of college. And for many families with infants and toddlers, childcare costs exceed their costs for their mortgages. When childcare is unstable or lower quality, which we've heard has been an issue during the pandemic, parents often experience work disruptions, lower productivity, and again, personally, they risk losing their earnings, but also employers experience situations where their employees have lower productivity. So the next slide lays out what we think of in terms of good quality and a good supply, and I'm going to turn it over to Heather.
Great, thank you, Diane. So what does, quote, good supply of early care and education look like? So as we talk about supply, we must also consider the issue of access. This is something we study a lot in our work at the Urban Institute is ECE access. So in some communities, if you build it, they will come. Childcare demand is so high that families are desperate to find available slots. And so you can fill those slots very quickly. But typically there are many other issues to consider, including whether families can even access the programs that are available. So when we talk about access, we say that parents need access to a supply of early care and education that meets their needs in terms of scheduling and location, supports their children's development and any special needs that that child may have, is affordable, and that the parent can find that arrangement with reasonable effort. Because in some communities, parents don't have good resources to help them find childcare. In some cases, new parents aren't familiar with the complex EC system that Diane just described, and they don't even know what their options are, and they're not familiar with the childcare choices that they have. So overall, in terms of meeting demand, we see that the supply of early care and education in the US is inadequate. And this is not a new issue. It's been a long-standing problem in our country. Even before the pandemic, we had a silent childcare crisis in the US. And I think many of us would agree that it took the pandemic to show the American public just how critical childcare is, not only to children and families, but to businesses and to the broader economy. And research shows that there's a gap in the supply of childcare overall, but it's worse for some groups of families and worse in some communities. In 2016, Childcare Aware of America and the Center for American Progress coined the term childcare deserts to refer to neighborhoods with insufficient supply of childcare. We have data from 2012, nearly 10 years ago, that shows half of US families lived in areas where there were about 2 preschool age children for every 1 childcare slot. So 2 kids for every slot in preschool. And that varied depending on the community. In comparison, half of families lived in areas where there were 4.3 infants and toddlers for every 1 slot. So about 4 babies potentially competing for that 1 slot in a regulated childcare program. And the situation is better or worse depending on the community, but is much worse for families living in rural areas, for example, that have very few options for regulated or licensed care. Since that study in 2012, the overall supply has gotten worse. From 2012 to 2019, we have available data that shows that the number of regulated home-based providers in the US has dropped by 25% and continues to drop in the face of the pandemic. Some childcare centers have closed their doors too, and studies are being done now to find out the extent of that impact of the pandemic. And so we'll have a lot more to learn in the coming year. But I'll just note with home-based providers in particular, they're critical to many families, and I think an overlooked segment of the workforce. It's the preferred childcare arrangement for families with infants, for families working non-traditional hours, and for many other families based on their language, culture, personal circumstances, transportation issues, just having convenience of going to someone in your neighborhood in a home. But home-based providers often work very long hours by themselves, and they can experience feelings of isolation, lack of connections to community partnerships that are typically found in childcare centers. And as a result, we see that home-based providers often face challenges in providing high quality and sustainable care. There's high turnover among that segment of the workforce in particular because they don't have the support they need to be successful and to sustain their businesses. There are many ways to measure childcare quality, things like educational credentials of early educators, child to adult ratios, the physical environment, materials, interactions between adults and children. But some research shows that access to, quote, quality may be better for preschoolers in some communities than for infants and toddlers, given the higher credentials typically required to teach public pre-K and Head Start. So consequently, we actually see that the education levels are lower among children serving younger children. In programs that serve only preschoolers, about half of teachers have a bachelor's degree or higher. Among infant toddler teachers in centers, only about 23% have at least a bachelor's degree. And among all home-based providers, only about 18% or so have a bachelor's degree. And this is despite mounting evidence from brain sciences shows us that the first 3 years of life are critical in children's development, and other mounting evidence that qualified early educators in a high quality setting are key for children's early learning experiences. So what is the state of the EC workforce? If you go to the next slide, I'll say a little bit more about what we know. So in sum, this is an increasingly skilled workforce. States and localities have been implementing many efforts in recent years to, quote, professionalize the early care and education workforce, efforts such as additional training requirements, in some cases, higher educational requirements, coaching programs, creating state core competency frameworks with standards around knowledge and skills that early educators should have, online workforce registries, and many other initiatives. Some I'm sure you're familiar with in your own states. Yet at the same time, even with increased expectations for what these workers should know and be able to do, they're earning near poverty wages. This is making teaching childcare among the lowest paid occupations in the United States. And this is even for early educators who have earned higher credentials and degrees. So about $23,000 per year compared to kindergarten teachers who earn about a median annual salary of $54,000. And we see that there are wage gaps depending on the age group that you teach and depending on race as well. So national estimates show this a significant wage disparity between infant toddler teachers and preschool teachers, including those with the same education level. So teachers with a bachelor's degree or higher suffer a wage penalty of about $4 per hour when working with an infant or toddler classroom compared to working with children ages 3 to 5. So what does that mean for recruiting talented teachers to work with our youngest children? There's a challenge here. And we often see that there's racial disparities in pay as well, with Black educators earning 78 cents less per hour than white educators, totaling about $1,600 over the course of a year. And we know that low compensation undermines program quality and makes it harder to recruit and retain highly qualified workforce. Historically, no states have set or required compensation standards for childcare and early education outside the public pre-kindergarten system. But a few states are now starting that work. In Delaware and the District of Columbia, for example, they're introducing compensation scales to give EC workers an equitable wage. Another key issue is workforce turnover, which I've mentioned a little bit. So the main reason for turnover, not surprising, is workers are seeking jobs with higher wages. This is a finding that has come up in national studies, state studies, before the pandemic, during the pandemic, people want higher wages. 40% of EC workers lost their jobs during the height of the pandemic, and about 1 in 8 have not yet returned. And we don't know if they will return. And many programs are having a hard time staffing their programs. So even if they're not at full enrollment, they can't even open up more classrooms because they can't hire more people. Next slide. So how has the pandemic made the early care and education crisis worse? There's a lot that we could say here. We have a link to a report that has a lot of resources. But nearly 2 years into the pandemic, the childcare system continues to struggle and parents continue to face childcare disruptions. Just last month, according to the Household Pulse survey from the US Census, 30% of parents with children younger than age 5 reported that children were unable to attend childcare in the past 4 weeks because of safety concerns related to the pandemic, 30%. I'm one of them. As a mom of 3 young kids, I've had to quarantine each of my children because of exposure at childcare or school, most recently just last week. And we're observing the impacts on parents, children, and their childcare providers who rely on getting paid for their own livelihood, their well-being. If they have employees, to be able to pay those staff. In children, we see are experiencing a learning loss and just general pandemic burnout. Just the stress and mental health issues that many children across age groups are facing. Black and Latina families and children, those with special education needs, those living in poverty have been affected the most. We see unstable enrollment and attendance has led to lower revenue and wages for childcare providers. We see that centers serving larger groups of children were hardest hit during the shutdowns, with some family childcare programs, those home-based programs serving smaller groups, were able to remain open. In many cases, they were actually what we call the unsung heroes during the pandemic, caring for the children of essential workers at the height of the pandemic and taking on more children than they typically do to relieve the demands on the childcare market. Next slide. So I refer you to 2 recent reports Diane and I have published on these topics. The first you see here is Strengthening the Diversity and Quality of the Early Care and Education Workforce. It summarizes key themes from 2 convenings we held with national experts and federal policymakers in the years just before the pandemic, and offers a set of recommendations, particularly around these issues of compensation. Next slide. And here is another report that Diane is first author on. That's the Racial, Economic, and Social Justice for the Early Care and Education Workforce, pre, during, and post COVID-19. So we held this in January early this year, so just about a year into the pandemic, again with experts and policymakers to really understand what we see in terms of the issues of the workforce and efforts that we can implement to help rebuild and to strengthen the workforce. Next slide. So what can states do to address the crisis? We list some ideas here, but this is not an exhaustive list, and each state is unique in terms of its existing childcare and education system and strategies to rebuild. But we suggest here, that states might use existing federal stimulus dollars to improve childcare subsidy payment rates, or scholarships, as some states refer to them, that can benefit providers and parents. So we haven't discussed this in detail here, but we know that childcare subsidy payments that go to childcare providers serving low-income children in many places are not competitive with the local childcare markets. Providers are often operating on razor-thin margins, sometimes losing money serving low-income children. They're paying, if they're getting paid based on enrollments and not attendance, however, that's one strategy that some states are implementing. They're able to maintain their business without losing as much in profits. Increasing staff wages. This obviously can help with recruitment and retention. Offering retention bonuses, helping providers so that they can provide better employee benefits, including paid leave, health insurance, which many of our workers do not have, retirement benefits, maybe offering these benefits directly to employees through a statewide or a county system, offering support services such as infant and early childhood mental health consultation. I have a research brief that I just published about this that talked about home-based providers in particular and how they could benefit from mental health consultation, having an expert come into the home to kind of help them deal with children's mental health and other behavioral problems. Addressing concerns about staff well-being. We know staff well-being was an issue in the pandemic and continues to be. Staff are stressed, feeling burnt out, lack of respect, and so forth. So things like having paid planning time, paid training hours, and just improving ratios in many programs. And this is not just a pandemic related issue, but many programs, there are just more children than there should be. We have to really kind of think about what it means to have a reasonable group size and reasonable ratios to have a high quality early learning setting. And given the pandemic, how we can help improve staff well-being by offering more staff support within the classroom. So I'm gonna pause there and turn it over to Diane. If you want to take over the next slide, she's going to talk a little bit more about new federal funding opportunities and can discuss a little bit more about other strategies that we've been learning.
Thanks so much, Heather. So I'm really excited that we will be hearing in a moment from Senators Johnson and Nelson about some of the important legislation that's moving forward in some of your states. With the federal funding opportunities, I know some people we're looking to the bipartisan infrastructure bill as a source of funds for early care and education. Most of the early care and education funding was moved out of that infrastructure bill. With that said, this has been passed, signed into law. It funds transportation, utilities, and broadband. There are some funds that can support childcare facilities. This can be a really important source of funds, especially for the facilities that are located in areas that are affected by lead pipes, for example. With that said, the actual dollars for early care and education services are not in that bill, but are in the piece of legislation that has not yet been passed called Build Back Better. This bill, which is still under development, there are various provisions in the House versus the Senate bills that are being vetted. The provisions have not yet been worked out. With that said, the child care and pre-K provisions are designed to increase affordability of early care and education. And both bills have funds set aside to increase wages for the early care and education workforce. Importantly, the states have a very important role in both the House and the Senate version of these bills. That is, the states can opt in to, in the same way that with Obamacare, states were able to opt in. States have an option of opting in to the early care and education provisions in the current bills that are pending. And unlike Obamacare, counties and school districts would also have an opportunity to opt in. So you might be in a state where the state decides that they are not interested in opting in, but a large city or a school district or a county could opt in to expand early care and education services. With that said, these bills have not yet been passed. As of this week, the provisions related to pre-K appear to have some momentum. The provisions related to childcare might or might not end up in the final piece of legislation. I saw that there was a question about what happens once the federal stimulus funds go away. Some states are using the federal stimulus dollars to develop strategic plans to think very carefully about what will happen if there are additional funds through Build Back Better, or if there are state resources. And again, a lot of states are really thinking about strategically using the federal funds, understanding the importance of a year in a young child's life, that this actually could have long-term benefits, but also thinking about supporting longer-term investments. So building up information about the consumer education opportunities that Heather mentioned, or using the funds to help providers invest in capital improvements if in fact they're not able to get up to building code. So there are different ways that you can think about allocating those funds. And in just one moment, we're going to hear a little bit from Senators Johnson and Nelson about what's happening in these states. But I just wanted to mention, again, the Build Back Better has not yet passed, but if it does, the federal government has started thinking about including a year of planning to help states build the capacity, understanding that a lot of state agencies might not have the capacity to immediately start offering services, and to really think about how the Federal Office of Child Care can work with states and state legislatures to build the capacity to best address the needs of children and families, as well as the early care and education workforce. So with that, the next slide is very hard to read, but everyone has the slide deck. We include hyperlinks to all of the resources that we cited. And so here are a number of Urban Institute resources that we included as hyperlinks in our slide deck. The next slide has resources that are outside of Urban Institute, but nonetheless very important resources, ranging from guidance from the Administration for Children and Families to information from the Assistant Secretary of Policy and Evaluation. And the final slide, we just wanted to not only share our contact information, and the next slide, we want to thank you for the opportunity to have this conversation today and to answer any questions that you might have.
Well, thank you, Diane and Heather, for that. At this time, we're going to take questions. So if you'd like to raise your hand, John and Laura will mediate the questions. And it looks like there's also some questions in chat.
Senator Holmes, did you have a question?
I do. I want to tell you, from doing all of these that we've been doing on all the different topics, what we've learned that you've just reinforced here in this presentation is this was shaping up to be a major problem anyway. As everything was.
She was way too.
I just heard some feedback there. And yet it seems like the pandemic just exacerbated all of the problems we were having, and they came to the forefront sooner. My concern is with the home-based childcare, being that we are right now entering another surge. I mean, we are looking at numbers that were as bad as they were last year at this time with the pandemic. So now at a child-based facility, I think very often maybe those parents themselves also have young children. And since we're talking about a population here that is not able to be vaccinated, I think, aren't we going to run into even those that were able to stay open are soon not going to have that ability if things keep continuing?
There are a number of different aspects to the question that you're posing. One is just financial viability. Some of the states that we've worked with, and we've just concluded a study in a southern state where they have taken their federal stimulus dollars and given stabilization grants to childcare centers as well as family childcare homes. And again, a point that Heather raised that feels like we study policy, so it sounds like it's very in the weeds, but it's really important. The idea of paying childcare providers based on enrollment as opposed to attendance is really important. And a lot of states are using their federal stimulus dollars for that. So what does that mean? Well, if you think about K-12 settings, elementary and secondary schools, those schools have a budget that they're given based on the previous year's enrollment on October 1, and they can plan, they can staff, they can design the curriculum and the services based on stable funding. In contrast, a lot of the early care and education services are reimbursed based on whether or not a child attends. So if you have a situation with fluctuating attendance because of health, like the pandemic or any other health situation, it could be that a child is sick. It could be that the caregiver is sick. You have a situation where that caregiver might go a month without any income. And that could cause, again, whether it's a family childcare home or a center, could cause them to collapse. So one way of addressing this is to provide funding based on enrollment. And some states are also looking at ways of vetting substitutes or backup care. And it's really important to make sure that if that is the case, that again, if we're talking about public dollars, these individuals would have to be screened and vetted, but to provide some backup for the parents, not as a long-term solution, but recognizing that there is a fluctuation in terms of the ability for children to be cared for. And then the third part of the question that you asked is about the health conditions. And we have seen an exodus of workers, especially. I thought this was funny. I was talking to, in one focus group, they mentioned older workers, but then they said over 50. So I thought that was interesting. But anyone over 50 is leaving the early care and education space because of health risks. Because again, even if they're immunized, and again, this isn't across the board, but some states are experiencing an exodus because of the health risk and are devoting dollars not only to immunizations of the caregivers, but to the personal protective equipment, and really thinking about ways of ensuring that the ratios are low enough where they have a cohort model so they can mitigate any health risks. Heather, did you have any follow-up to that?
I'll just add, within the home-based family childcare context, we often see the success of family childcare networks. So having a staffed family childcare network, which is basically a way to connect home-based providers within a community so that they can support one another to reduce that feeling of isolation, but also in cases like this, where you almost have like a substitute pool where you might come together to say, I need to close my doors for 2 weeks because of exposure, and try to figure out a way, to move children to neighboring programs within that network and sort of have agreement to do that, or to have a substitute pool. So to have sort of backup care providers that are hired through that staffed network that can kind of be sent out to programs when support staff are unable to attend. So there's definitely strategies of ways of doing this. I think it's just having some innovation behind it, kind of think outside the box of what might be possible. But I think one thing that Diane and I have talked a lot about is just thinking about the different care settings and the diversity of these settings and ideas for supporting not just childcare centers, but also home-based providers. And so one strategy might not work for all, but really thinking about what can work for each unique setting.
Okay, sounds good. We do have one question here. Question, is there any discussion about including child welfare workers in some of these provisions or programs for workforce assistance with pay, burnout, shortages, et cetera? What are you hearing from your positions about that?
Heather, do you want to answer that? I have a little frog in my throat.
No problem. I'm not familiar with a model of having child welfare workers, but there's definitely partnerships, between agencies that can, provide support staff to childcare centers. I mean, I had talked about a model of infant and early childhood mental health consultants, which are trained experts, professionals who can come into a childcare center or a childcare home to provide support to the provider, to the family when a child has been identified as having a behavioral problem, or there's just more need for support within that program. There's lots written on this, but it's sort of a tiered model where you might have some preventative measures and then some more intensive measures for children who are at higher risk. But that is a very successful approach where you're helping that provider kind of understand child development, understand strategies for working with that child, particularly during the pandemic where I think staff are very burnt out, as we've talked about. Children may be experiencing some elevated behavioral problems. And so just giving providers the tools to be able to manage those behaviors to reduce things like childcare expulsion, which we haven't really talked about, but it's definitely an issue in many programs where providers just are unable to attend to that child's needs and ultimately has to ask the family to leave the program. So I think that there are opportunities here. I think what you may be referring to is just relying on the child welfare workers, if there are staff available, to maybe come into programs to kind of fill like a staff shortage. But if you have more thoughts on that, it would be great to hear.
In terms of another model that Heather has studied extensively is a home visiting model and approach. And Early Head Start actually offers that as an option.
Okay. I did want to revisit the question by Senator Charbonneau about the federal funds. I just wanted to make sure, Senator, that you felt that, I know that Diane addressed this and wanted to see if you had any follow-up to that before we moved on. I know we will be talking about with Senator Nelson and Senator Johnson a little bit about the use of some one-time funds, but just wanted to see if you had any further questions for Diane or Heather at this time, Senator. I'm not hearing the senator, so we do have another question that's posted that said, how are Head Start programs funded? Flat grant per registered child, per attendance?
I'm sorry.
Sorry,
Laura
Senator.
Charbonneau, I was having a hard time finding how to unmute myself on this thing. And I guess it's, the question I asked would pertain to, there were suggestions about using the funds to give pay increases and things like that. But I would be very uncomfortable, or I wouldn't want to do it simply because once they go away, the stimulus money goes away, that the burden is going to fall on whoever, or we're going to have to cut the pay. And that's not I think, a good thing to do.
And as I said, Senator, we're going to talk about that a little bit more with the other senators who are on here. And so maybe we can engage in some more conversation on that. And then in the meantime, we have a couple of questions going back to the Head Start question from Senator Pappas. How are they funded? Is it a flat grant per registered child, per attendance?
So Head Start is a direct grant from the federal government to the grantee. It's based on per child who is enrolled, so it's not reimbursed based on attendance. There is an attendance requirement. So if children do not attend for more than 10% of the time, The program works closely with the family to mitigate any underlying needs or issues that the family might be addressing. And let's say it's a health issue or some other issue. But with that said, it is based on enrollment. There was a slight increase in Head Start funding based on the stimulus funding. And it is projected to increase if Build Back Better goes through. So a lot of local programs might partner with Head Start because of the stable funding and look to blend or braid Head Start funds with either pre-K or childcare funds to provide more comprehensive services to children in the community.
Could I do a follow-up question?
Yep, certainly.
Yeah, I wanted to know if you know what the salaries are for Head Start teachers. I mean, is that kind of a model that we could look at in terms of, are they getting better wages? Are they getting better benefits?
So Head Start teachers their wages are higher than childcare, and they have a better benefits packages. It's still lower than kindergarten teachers. So the two reports that are in the chat have details about the exact dollar amount of that the individuals make in different settings.
Mhm.
But Head Start is a higher compensation package. Interestingly, and to the point that Heather made about infant toddler teachers making less than preschool age teachers, early Head Start educators make less than Head Start educators who are working with preschool age children. So across the board, you do see lower wages for those who are working with the youngest children. And again, that's the time when brain science is showing there's the biggest benefit of providing stimulating environments for young kids.
So Head Start programs are usually just part day, though, right? So are those teachers full-time?
Very good.
That can make a difference in their overall wages.
So what, for the most part, what you see is a part day in a center or in a home, but that educator will be employed full-time because Head Start and Early Head Start are comprehensive service programs. And the individual who works with the child might also be involved in developing a comprehensive service plan for the child and the family. And so it's more of a 2-generation program. We hear a lot about 2-gen, and Head Start and Early Head Start actually started that way, working with the child and the family to address the comprehensive needs of children and families. So we've taken a look at the compensation based on full or part-time. So these are per hour amounts that we're looking at. Heather, do you have anything to add?
No, I think that's perfect. And I think I was just going to add that early Head Start teachers have much greater retention, than we see among infant toddler teachers in childcare centers. So Head Start and Early Head Start sort of are the model, and we often talk about that as in terms of performance standards, in terms of staff credentials and quality of the settings, and so that we do see that when given an option, young workers entering the fields are often attracted to Head Start because of that comprehensive service model. But often because of the higher salary that they're entitled to, better benefits, and they do see in the long run greater retention among that workforce than staff that are working in a childcare setting, childcare center where staff often kind of come and go more regularly.
We have another question in the chat that is related to raising the wages of workers who are income eligible for medical assistance. And of course, if the wages go too high, they lose that access. Is there any discussion about the income levels associated with that to help those workers?
Our colleagues, Linda Gianarelli and Sarah Minton, have done a lot of work on what is called the cliff effect of that is, you see a cliff effect with the child care subsidy program and also with other benefits programs. I know that this has been raised as an issue, but again, it's a concern when you have a very high percentage of the early care and education workforce that's currently entitled to public benefits programs because the compensation is quite low. I don't know that I have seen any modeling of what might happen as a result. But I do know from the work in the K-12 setting that educators who are compensated and have both the compensation benefits packages and status associated with a professional position, it tends to increase retention.
Okay. Thank you. And then we're going to go to raised hand. Terry Austin. Would you like to unmute?
Thank you so much. I was just getting ready to type my question in. So most of these examples are funds that flow to the families. My question is, and it particularly is for small businesses, are there any models out there that help small businesses in communities either collaborate together or work with local school districts or the other organizations in their community to create either on-site childcare opportunities or community-centered childcare opportunities? So many times they're just sort of left out of the picture, but they are hit very hard and are suffering just as much as, whether it's an individual employer or whatever. Are there any models out there that you all are aware of? And also in your work, did any of you get a sense of how many companies are actually taking advantage of making their employees aware of the flexible spending accounts that families can put their money into pre-tax dollars for childcare?
I will respond to the first part of this, and then Heather might have some additional responses to the second. There are quite a few states that have what's called state-funded pre-K, but it's actually a funding stream that that requires a certain percentage of the dollars that go to either community-based organizations or small businesses. So, for example, New York State had a number of 4 different pre-K programs because the programs were authorized under different, in different periods. And they started out with a 20% requirement that the funds 20% of the funds should go to community-based organizations or childcare providers. But those childcare providers and CBOs needed to meet certain quality standards. It turned out that in a lot of places, especially rural areas, that percentage increased. It was at least 40%. This was a number of years ago. That was when I last looked at it. This was a benefit both to the community in terms of stabilizing the childcare, but also in some areas with the facilities, they just didn't have the facility to actually offer a new classroom, in the elementary school. So there are definitely models out there of allocating some of the, whether it's pre-K or childcare funds to stabilize the childcare market. And Heather, do you want to elaborate?
Yeah, that's a good example. I mean, I was just thinking within, it's a little bit different of a response, but within home-based childcare, we often speak of shared services business alliances that really help those small home businesses. So maybe a single provider, but is responsible not only for caring for children, but preparing meals and cleaning and doing all the administrative work that is required for running a business, all the accounting and paperwork for licensing and meal programs and so forth. So this shared service business alliance is a model where basically home-based providers are pay a small fee to be a part of this alliance or network where this hub provides all of that administrative support, and so kind of helps with an enrollment paperwork and accounting and so forth, so that the providers can really just focus on caregiving and not have to worry about the billing and all of the things that kind of come extra because they do work very long hours. And so that's one support model for those small business owners.
Okay, thank you.
Thank you again, Diane and Heather. And we're going to move on to the next presenter so we don't run out of time. But I would ask attendees, participants to hold their questions till the end, and we will try to get to as many as we can. So I'm really pleased to introduce two Midwestern legislators who have extensive backgrounds and experience in working on the issue of high quality and affordable childcare and education in their states and communities. We have Wisconsin Senator Latonya Johnson. She's been a state legislator since 2012 and served 2 terms in the Wisconsin Assembly before being elected to the Senate in 2016. Prior to her election to the legislature, Senator Johnson owned and operated an in-home family child care center for more than 10 years. In 2006, she helped organize over 400 child care owners as a volunteer member organizer for Ask Me, establishing Milwaukee's first child care union. In the legislature, she is a member of the Budget Writing Joint Committee on Finance and the Senate Committee on Human Services, Children and Families, as well as several other committees. Minnesota Senator Carla Nelson was elected to the state Senate in 2010 after having served for 2 years in the House of Representatives. Education, jobs, and economic growth have been her legislative priorities as a lawmaker. She has a background in education, including working in the classroom as special education teacher and a reading specialist. This past year, Senator Nelson sponsored legislation to increase available childcare options, and she currently serves as chair of the Taxes Committee and is a member of the Health and Human Services Finance and Policy Committee, as well as the Human Services Reform Committee, and she's on the Governor's Workforce Development Board. So thank you for joining us, Senators Johnson and Nelson, and for sharing your expertise with us today. I'm going to turn over things to Laura, who will walk you through some questions to get our conversation started. Laura?
Thank you, Representative. And if I can, Senator Johnson, I'd like to start with you. I'm going to ask you to take your legislative hat off for a second and go back to your days as a child care provider. And obviously you've worked as a provider, you've worked with child care workers, and you've also worked with parents who are working their way through the search for child care. In thinking about your experience in that regard, what can you tell policymakers from that perspective about the challenges facing the industry as you see them?
Thank you for this opportunity and for the opportunity to be here and share some of my experiences. I'm so delighted to hear this conversation taking place with so many professionals. I've spent over 10 years of my life as an in-home child care provider. And my daycare operated 24 hours a day, 7 days a week. And one of the things that I noticed most and foremost as a child care provider was the need for equitable services across the state. Quality care costs. And for so many of our low-income families and working poor families, quality care is unobtainable because of the parent's portion of the copay. Even for our low-income families who receive subsidies from the state to pay for childcare, a lot of times the money that's left over, that's a requirement for the family's portion to pay for childcare costs. Depending on where they enroll their child, especially if it's in a quality center, the share subsidies are not enough to cover the entire cost. So the parent's portion then becomes extremely important to helping to bridge that gap. And the more quality the care, the more expensive that care becomes. And for so many of our parents, they can't afford the quality care. And so that leaves them with no other choice than to place their children where they can afford. And in some cases, that's not a quality center or a quality in-home environment. So one of the things that I noticed is that the need for the state to contribute more to help those daycare centers improve their quality of care. Here in Wisconsin, we operate under a system called YoungStar, and YoungStar is a quality rating system that goes up to 5 stars. The only problem with that is that it's only a requirement for those centers that receive Wisconsin share subsidy payments. So for those centers that are operating that don't allow children who receive those subsidy share payments, they don't have to participate. That means that quality of care is not rated. And for those parents who can afford to pay the higher quality of care, those children never get to mingle, never get to interact with those children that are receiving care at the lower cost. Also, the wages, as was said before, for our daycare providers is extremely low. So making sure that those wages, at least our family sustaining wages, is extremely important. And I would also argue making sure that daycare hours are available for those who are daycare providers and early childhood teachers to be able to go back to school to further their education. In most cases, those teachers use their hours because a lot of them do still qualify for subsidy childcare for their own kids, which just shows how low they're being paid. They use those hours to work. And then when they're expected to go back to school to increase their educational status, they themselves find a problem with being able to afford childcare in order to go back to school and increase their education. So those are just some of the problems that we see, but also making sure that centers and providers are being paid on those enrollment bases, as was discussed earlier. My daycare center went out of business when we started being paid on attendance base. Me being 24 hours, 7 days a week, I had teachers that worked for me. Sometimes children get sick, the families go on vacation, and those children are not able to attend. But the cost for providing that quality care still continues. And as a result of that, we couldn't afford to make our bills, and my daycare had to shut down in an effort to prevent my family from going into poverty. And so those are just some of the things that we need to think about when we're trying to increase the quality of care.
Thank you, Senator. Senator Nelson, looking to Minnesota, I know that this is an issue that you've worked on for a very long time there in your state, but I want to take a quick look at what you've done this session. I know that you were very much involved in passing a bill this year that addressed some of the issues related to childcare, and just wanted to give you a chance to tell us what you did and what the components of that bill were.
Great. Well, thank you, Laura. It's great to be here. And I just wanted to really thank the Council of State Governments Midwest for your insight, really, in looking at economic development and all these different intersections that really are required for economic development. And as we've heard today, of course, childcare is right at the center of that. We had a childcare crisis, as we've heard before the pandemic. And now, of course, we also have that workforce crisis for many of the reasons that have been discussed. And so Minnesota is not unique to that. And in fact, even before the childcare crisis and the workforce crisis, Minnesota was a real leader in high quality early learning childhood and childcare or child early education. And that really started actually my freshman year in the Senate. So back in 2011 and 12, Minnesota businesses were finding that they couldn't get the workers that they needed. They also were insightful enough to realize that so much of the workforce depends upon the quality of our education. And of course, Minnesota has unfortunately too been one of the nation leaders for a good deal of time in having some of our largest educational gaps. And so Minnesota businesses actually met together and put their money where their mouth was, and they developed MELF, Minnesota Early Learning Foundation. And that was the beginning, $20 million of private funds from businesses who realized they needed great education. And education really starts making sure you have kids that are prepared for kindergarten when they get there. So it was $20 million of private money that started a Minnesota early learning fellowship scholarships. We call these targeted high quality early learning scholarships. We have funded them significantly since then with state money because they have had tremendous results. Number one, providing that high quality childcare, which is so important to our workforce, immediately allowing moms and dads to go to work and know their children are in safe, not just safe places, but care that is preparing them for successful entry into kindergarten. And so Minnesota has been a leader in that area. And we've continued to do so through the Minnesota model, which is, you've talked about braided funding not only from privates, but federal funding, state funding as well. And then a unique thing about Minnesota is it is multi, the settings could be either in-home childcare, center-based care, church-based care, any care, early childhood that is actually preparing kids for kindergarten. And so these childcare scholarships then empower parents, funded with state, federal dollars, empower parents to choose what early education setting best fits the needs of them and their child. And it could be a public preschool. As I said, it could be center-based, could be home-based. So all of those things have been really important in the Minnesota model. But the discussion today is often, I think, illuminated, and I saw some of the comments as well. Well, if we talk about increasing the wages, which goodness knows is important, if we talk about increasing the education levels of our early educators, all of those things add to the cost of childcare, high quality early learning childcare. And so that's why it is so important, I believe, and why the Minnesota model has been so successful and been replicated throughout the nation, is because these are targeted. Rarely do governments have enough money to fund everything, and so one of the key things is these early learning scholarships are targeted to low-income parents of children who would not otherwise be able to get high quality early learning. So that's kind of the background. So this year, then when we got hit with the COVID crisis, and then with the really unprecedented amounts of federal money, there was a great coalition of childcare providers and businesses, people who are all interested in early learning and the importance of that in childcare. And so they formed a crisis working group. And that included things like the Minnesota Business Partnership, the Minnesota Chamber, Think Small, Close Gaps by 5, Family First in Minnesota, First Children's Finance, West Central, ADA, Southern Minnesota Initiative Funds, Ed Allies, Indigenous Visioning. I could go on and on about the number of Minnesotans who started working together to look at how can we address this crisis work group? How can the work group address the crisis in early childhood and in the education outcomes, and that our workforce shortage was presenting? And so this might be a model going forward. The coalition worked with a federal funds expert in Washington, D.C., who analyzed the federal funds coming to Minnesota for early learning and childcare. It happened to be about $524 million, unprecedented, federal funds coming to Minnesota. And so this early learning workforce crisis group looked at what things we know what works, and what of those things were eligible for the federal funding. And so we put together a package of about $524 million of funding to use those federal funds to address our workforce crisis, our childcare crisis, and our educational opportunities gap. And much of it was very successful. We did several things actually with this funding. One, we looked at building the staff, building out, empowering the staff through additional training. And then, of course, there's also looking at those hard costs of the facilities. And then because of the targeted early learning scholarships, that gets to the point that was made earlier too about access. We need to have the high quality, but it needs to be accessible. And we would need those public dollars to help hold down the cost for Minnesotans. So many of those things passed. I would say the one thing that did not pass as part of our $524 million, we called it the Child Care Revitalization Package, is one of the things that I think is most important, which are those targeted early learning scholarships, high quality early learning scholarships. And there is money that is left. And of course, I'll be working on that in the 2022 session as well, looking at how can we harness those federal dollars to target resources so Minnesotans who could not otherwise afford high quality early learning are able to do so.
Great. Thank you, Senator. I'm going to come back to the issue of the use of the federal funds in a little bit, but Senator Johnson, I wanted to come back to you since Senator Nelson was talking about some of the disparities and low-income parents. I was hoping that you could tell us a little bit about the pilot project that ran in your zip code and community that you represent there in Milwaukee, and talk about those efforts to kind of move the quality of care through that pilot project.
Sure. The one thing that I'm super excited about is that here in Wisconsin, our Governor Evers, used to be the state superintendent. So when it comes to education and being concerned about kids, he gets it. Governor Evers allows each one of the members of the state legislature to have about 15 minutes to talk about pet projects that they want to see done in their zip code. I represent one of the city's poorest zip codes, which is 53206. I represent parts of that area. In 53206, before the pandemic, the median resale value of a home in that area was just $4,300. And 70% of the individuals living in that zip code had some were convicted felons, either current convictions and currently on paper or past convictions. So the one thing that we learned from that zip code is that, you know, if a community has the resources, they can kind of wrap their arms around those in need and take care of their own. But because of the high poverty in that zip code, there just wasn't any resources available for that zip code to do that. So one of the things that I talked to Governor Evers about was creating money set aside for 53206 to invest in a 5-star daycare facility, which the zip code had absolutely none, not even one. And the one thing that I knew is that if we were going to address the educational gaps between our Black and white children, then we had to do something around early childhood education, and that had to evolve around creating at least a 5-star daycare center in that zip code. Governor Evers set aside $1.6 million in the budget for that specific zip code. And he came to me and he said, I put the money in the budget. It's your responsibility to keep it there. And so after conversations with my Republican colleagues, that was my one ask for that zip code. Now, the importance of having those dollars dedicated to 53206 made a world of difference. For example, those co-payments that I was talking about, which were the parents' portion that were left over from the subsidies, from the state subsidies that the state paid towards the level of care. So the state was able to set aside specifically for 53206 an additional $105 for those children that were in all day care. And that was specifically for that zip code, specifically for those children that were receiving state subsidies, and $79 for those children that were receiving part-time care. That money went specifically to the parents to help pay their parents' portion of what was left over that the state subsidy didn't cover. The other thing that we did in that zip code is that we raised the wages for childcare providers and workers specifically in that zip code. We added, I believe, additional funding to make sure that those teachers' salaries were raised, that the daycare providers' salaries were raised, to just make sure that those who were providing that care in the hardest hit zip codes were able to have a family living wage. The other thing that we did, we created Teach Scholarships. And basically, Teach Scholarships are for those individuals who are looking to further their education in early childhood education. What it was, it's a systematic approach to help enhance academic success by developing staff development and supports for early childhood education programs in 53206. We created 30 slots, and those were $2,500 awards or stipends for childcare providers and owners to go back to school to further their education to help increase the quality ratings of their daycare centers. We also created scholarships for infant toddler credential programs. Basically, that's a 12-hour credit program from our local technical college that helps to increase the registry standing. The registry is a system that's used for childcare providers, and it rates those providers based on their level of education. So the infant toddler credential would help those providers obtain a level 9 on the registry, and the registry goes up to a level 23. Those who have a bachelor's degree in early childhood education would be an example of a level 23. And what we found from doing that is that 22 students from 53206 completed all of their 12 credit classes from our local Milwaukee area technical college. And those 22 providers are now at least a level 3. 11 students have applied for the TEACH program that would help to further their individual education and help them obtain higher education. And the TEACH program helps people who are working toward their bachelor's degree or their associate's degree in early childhood level education. So by providing those scholarships and those programs, we help to elevate those daycare centers to a higher level on the Young Star program. And we also contracted with our local 4Cs coordinator, which provided outreach to over 55 childcare centers in the 53206 program, providing information about the supports that are available in that zip code in hopes that more daycare centers and more teachers would apply for those programs. It was an overwhelming success, so much so that the governor tried to implement that same pilot program in other zip codes throughout the state, and particularly in the city of Milwaukee, where the poverty is the highest and the subsidies are also the highest. Unfortunately, that part of the program, that part of the budget was pulled out and wasn't included, but they still left the funding for 53206. So the next budget cycle, we will plan on implementing that pilot again for the other additional zip codes that are most heavily impacted from poverty and educational gaps in an attempt to get at those kids that are most vulnerable in those earlier years, even before they reach the K-4 programs, in hopes of seeing higher proficiency and a closing of the educational gaps. And I was just so honored to be a part of that, but not only to be a part of it, but to actually see in real time the evidence-based progress that we were making in just that one zip code, and how that could be replicated not only throughout the states, but in other zip codes in the city of Milwaukee.
Well, congratulations on your work on that. And I hope it does continue in Wisconsin. There's a lot of components to that. So if anyone is interested in more information on that, certainly Senator Johnson's email address is up on the screen. Feel free to reach out to her office, or you can reach out to us and we'll put you in touch, because there's a lot of components to that. And I could see a lot of people being interested in looking closer at that for their own communities. I am going to go back to that question about the use of federal funds. As Senator Charbonneau expressed earlier, his nervousness, I think, is one that is shared among policymakers about when you have those one-time funds and applying them to programs, that it's the best interest to have those continue. Can you both, Senator Johnson and Senator Nelson, talk about that? Because both of your states in the past several months have used that in the childcare area. But what I'm thinking about is, how do you take advantage of those funds to get something started, and how do you use that to springboard to build some sustainable systems for these programs?
Sure, I'll be glad to weigh in on that. Oh, that's a very good question. I think that's something that all of us have been thinking about as we've had just this enormous outpouring of federal funds. How do you best leverage those federal funds, those one-time federal funds, for ongoing gain? And to do that in a way that does not lead to further growing state budgets beyond what those states can afford, or that leads to the necessity of making drastic cuts as those federal funds run out. And so that's something that's been, I know, key in my mind, and I think maybe many others as well. And so one of the things that we did do with the child care revitalization package, while I mentioned that the early learning scholarship part did not pass, the many other places that did really looked to building the infrastructure, so to speak, for childcare without adding the additional ongoing costs. Just today, the Minnesota Department of Deed released over $2 million, about $2.25 million of grants to help actually build those childcare facilities. And then also there were further aspects of the child care revitalization package that went to that teaching and that retaining to help develop the child care workforce itself. And so I think those are some things that help. I am cautious about building structures that cannot be maintained. But again, these are grants to private entities for building those, or helping build out or refurbish, or maybe an empty Main Street storefront to be able to renovate, refurbish what were once necessary spaces, which still are, but I'm just saying that things have changed a bit. And so perhaps now there's an empty storefront that could be a child care center. We're seeing some of those type of things in Minnesota with the funding that we did pass.
Senator Johnson, was there anything you wanted to add?
One of the things that Governor Evers did, he knew that actually keeping daycare centers open and as viable as possible was the key to our recovery. 54% of the children in Wisconsin, even prior to COVID, lived in a daycare desert. And that's where it's 50 children under the age of 5 either have no childcare providers or so few options that there are more than 3 times as many children as licensed childcare centers. And so what we saw between March 1st and May 1st of 2020, we saw 54% of our large licensed group daycare centers closed compared to only 18% of our in-home family providers. And a lot of that was due to COVID, due to the numbers. And so what we did was the governor invested $131.5 million of new federal funds in the childcare industry in an effort to stave off some of the negative effects of the COVID-19 pandemic. In addition, the governor recently announced an additional temporary rate increase of $10.2 million, and that was specifically for children 0 to 3 years old, because of those children being too young to be vaccinated. And we knew that there was going to be an increased need for additional protocols due to the pandemic. And so we wanted to make it more affordable for families while providing additional support for childcare centers. The state also implemented $148.8 million in the federal childcare and development block grant funds to provide additional responses to the ongoing effects of the pandemic that was had on the childcare industry. And some of the things that the governor did in terms of the COVID-19 emergency program was that we invested $51 million in funds to 2,712 providers statewide who applied. And that money was used for grants to help buy masks, to help buy cleaning supplies, or anything that was needed in order to help those daycare centers comply with the COVID-19 restrictions. Milwaukee County saw $14.2 million paid to 878 childcare providers, and these payments were supported for the cost of providing care for essential workforce families. For example, holding slots open for those individuals that were frontline families to make sure that they had daycare in the time of COVID-19 was extremely important. So providing incentive pay for childcare providers and individual educators, reimbursing families and other allowable expenses. Another thing that we did, Milwaukee County invested $19.2 million for 948 childcare providers. And these payments help to support the cost of maintaining or enhancing high quality childcare. The money could be used for mortgage, rent, utilities, PPE, materials or supplies for cleaning and sanitation, professional development and continuing education, anything that was needed, including sign-on bonuses, to make sure that we could retain our current childcare staff, but also for future staff as well. And an additional $25 million was given to 1,073 childcare providers, and that money was used to maintain high quality childcare also through those same additional PPE materials, supplies for cleaning, mortgage and rent utilities, just to keep those daycare centers afloat and make sure that we had those facilities available when they were needed. For so many of our group centers that were forced to close or forced to close their so many of their rooms to comply with the COVID-19 restriction, that was extremely important in being able to make sure that those mortgages, rents, and utilities were paid. And we also allowed our family daycare centers to take on additional kids to help take up just a little bit of the space and slots that were lost when our group centers were forced to close some of their classrooms.
Great, thank you for all of that. And thank you both for sharing all the information from your states and the work that you've been doing on this issue there. We are going to wrap up. I know some questions were being addressed in the chat for some other issues, and I don't see any further questions right now. So with that, I think we will turn it over to Senator Holmes to wrap up for us.
Thank you so much, Laura. And I want to give a big thank you to Representative Schultz for your help in leading today's event, and to our colleagues on the MLC Health and Human Services Committee for co-hosting this event. A special thanks to all of our presenters for the time and effort they put into offering some great information for us. And thank you to all the participants for taking time out of your day to join in. And on behalf of the Economic Development Committee, we hope that you'll continue to join us for other sessions in this series. The final 2 sessions in the series will be in January. One will focus on how states are using federal COVID relief funds, and the final webinar will be on the Midwest US-Canada trade and supply chains. You'll receive an email notification on registration when that's open, and we hope you'll join us in January for both of these virtual events. So thank you, Laura. I'll let you close out, and I do want to wish everybody a happy holiday.
Thank you, Senator Holmes, and thank you all for joining us today. Thank you to our speakers, to Diane and Heather and Senator Nelson and Senator Johnson for sharing all of your expertise and knowledge with us today. I do encourage you to join us for those final 2 webinars. You'll be receiving information about how to register soon. In the meantime, I hope everybody has a happy holiday and enjoy the rest of your day. Thanks for being with us.